My COVID-19 plan. Stay home. Stay safe. Plain talk for pandemic times. Cover art by Ivanova Smith. Life has changed a lot. Instead of going to school, work, or out of events, everyone's asked to stay home and stay healthy. Wash your hands for 20 seconds. Don't touch your face. Cough into a tissue or your elbow. Don't share food or utensils. Only go out for medical appointments, essential shopping, or outdoor exercise in your neighborhood. Cover your nose and mouth. If you have a high sensitivity to touch or textures, try a scarf or soft fabric to use as a homemade cover. Keep 6 feet distance. 6 feet is about the length of 2 shopping carts, or a little more than 2 arms' length. What if I get sick? If you feel sick, call your doctor or clinic first. Do not go in person. If your doctor thinks you might have COVID-19, they will order a test. The test is done with a long swab into your nose. It could take days to get the results. Before you get the results, you will need to isolate yourself in your home. It's called quarantine. If you test positive, you will have to quarantine for at least 2 weeks. If you share a home with others, you will need to stay in your room to keep others from getting sick. It's hard to stay separated from others, but there are things that could help make it easier. Use technology to stay connected with friends and family and caregivers. Put your favorite entertainment in your room: video games, art, music, puzzles. Ask the people supporting you to shop for your favorite foods and drinks. Set up a table or desk to eat or do activities. If you need extra support, contact your case manager and let them know if you need some extra hours or services. The resources for staying connected and engaged. Even if you are separated from others, you don't have to go through this alone. Assistive technology resources. If you are on a DDA, IFS, or Basic Plus waiver, or Community First Choice, dshs.wa.gov/DDA. Technology Equipment Disability Program, TED. informingfamilies.org/TED. Online activities. Comcast Internet Essentials. For $9.95 per month, plus tax, for people who receive housing assistance, Medicaid, SNAP, SSI, or other low-income services. InternetEssentials.com. Free art lessons. YouTube/C/Wildfree and Crafty. Netflix Watch Party. NetflixParty.com. Tiny Desk Concert. NPR.org series Tiny Desk Concerts. YMCA at Home. YMCA.net. Social Connection. Best Buddies Washington. bestbuddies.org/Washington. People First of Washington. peoplefirstofwashington.org. Special Olympics Washington. specialolympicswashington.org. For more resources and ideas for connection, visit informingfamilies.org/COVID resources. There are new restrictions, but you still have rights. During the COVID-19 outbreak, the governor has put in place new rules in the hopes to keep people healthy. If you have questions about the new restrictions, ask your case resource manager or your provider. Even with these limitations, you have rights. Your rights include the right to be safe, the right to be free from abuse and neglect, the right to contact your DD case manager if you're unable to be safe with the supports and services you have right now, or if you are unhappy with the supports you are getting. If you're experiencing these things, they are a sign of neglect, abuse, or exploitation. Physical abuse, when somebody hits, pushes, or shoves you. Emotional abuse, calling you names or doing things to make you feel bad about yourself. Sexual abuse, touching body in private areas when you don't want to be touched. Financial exploitation, taking your money or belongings or pressuring you into giving away your money or belongings. Neglect, somebody is not taking care of you the way that they're supposed to or not giving you the help you need to take care of yourself. What do you do if you've been abused, neglected, or exploited? Call End Harm at 1-866-363-4276 or go online to make a report. Your message will be sent to the best agency for your concerns, such as Adult Protective Services, APS, or Residential Care Services, RCS. If you aren't sure whether or not your rights have been violated and you are not in immediate danger, call the Office of Developmental Disability Ombuds at 1-833-727-8900. If you are in immediate danger, call 911. Resources for safety and rights. End Harm 1-866-363-4276. This toll-free number for reporting concerns about child or vulnerable adult is operated 24/7, 7 days a week. Aging and Long-Term Support Administration, OSTA, dhs.washington.gov/ALTSA. Click on the Report Adult Abuse icon. Disability Rights Washington, disabilityrightswashington.org. DRW is a private nonprofit organization that protects the rights of people with disabilities statewide. Office of Developmental Disability Ombuds, ddombuds.org. The DD Ombuds provides resident-directed complaint resolution at a lower level possible. My plan for physical and emotional health. Ways I can stay physically healthy. To stay healthy, I need support to keep my hands clean, wash surfaces in my home, make and wear face coverings or masks, learn how to stay safe distance from others. Ways I can care for my emotional and mental health. Talk to a friend or family. Talk to a mental health counselor. Exercise. Listening to relaxing music. Stretches, yoga, breathing, video journaling, or other. To cope with these changes in life, I need support to express my feelings, communicate my choices, create a routine that works for me, shop for my favorite foods and drinks. Other. My favorite food and drink. People I want to stay connected to. How I will stay connected with them. Phone, text, FaceTime, Facebook, Zoom, Skype. To stay connected, I need support to make a call, connect to the internet, find my friends and family online, set up an online meeting and invite others, find new activities, learn how to communicate with a telecommunication device or app. Other. Who will I talk to about abuse, neglect, or exploitation? Someone I trust. Their name is my DD case manager. Their number is End Harm/Adult Protective Services 911 Office of the Developmental Disability Ombuds. How will I contact them? In person, on phone? The number is online or by email. What am I going to say? What happened? Who did it happen to? When did it happen? Who did it? Who or if anyone was there? How did I feel physically, emotionally? Other information. What do I want to happen? To be safe? To leave the situation? Have someone check on me times a day, week, or month? Get someone new to support me? Get more support. Talk to an advocate. Learn to protect myself. Other. People I have contacted. Name, job title, agency or location. When did I contact them? Day or month? Time. Did you talk to them or leave a message? I talked to them. I left a message. I sent an email. What did they say to me? What are my next steps? This Plain Talk booklet on COVID-19 was created by Informing Families in collaboration with the Washington State Office of the Developmental Disability Ombuds. Special thanks to Ivanova Smith for covering art and content consulting. Copyright 2020. Informing Families is a resource of the Washington State Developmental Disability Council in partnership with Washington State Developmental Disability Administration.